Good morning. This is Dr. James. I'm going to give you just a brief overview since some of you, I believe, are getting a little stressed out over the exam. And this, of course, is going to follow your blueprint and it's going to follow everything that Miss Bradford told you to read and to look at. So I'm just going to give you some brief things to make sure you go over. Behaviors of the newborn, everything that Ms. Bradford talked to you about, um, of assessment and how a newborn behaves, what the normal physiological changes are. Make sure you read that in your book. Um, what type of an environment we're looking for to support the newborn and the newborn's health. Let's see. I'll talk to you about assessment, the motor functions, motor responses, and the behaviors that we're looking at after a baby is born. What are all the normals? What are the vital signs? What are we expecting? What's abnormal? What's normal? What are all the ranges? Um, what happens how can we tell if a baby's too warm, too cold? What are some measures we can take? Head to toe assessment, very, very important. There's some good resources in your appendix as well as in your book. Anything that is contradictory in your book, please follow what we have told you in class. If you are finding any other contradictions, please bring our attention to it, and we will follow up with the publisher. But since Ms. Bradford and I are both practicing nurses, we won't steer you wrong. We will help you know what the right thing is to do. Of course, know all of your reflexes, what's normal about the baby, the head, suture lines, everything that she talked to you about last week. Why do we do an APGAR score? We talked about that a little bit in labor, and then she talked to you some more. Why is it important, and what are we looking for? There's also some things in your appendix about that. Getting back to labor, what is true labor? What is false labor? What are the findings? There's a really good chart in your book for that. What are we looking for to help her know whether she needs to wait to come in? You remember we were talking about, should I stay home or should I come in? What are the priorities in our assessment? How do we know what we need to check, when we need to check it? Look over your fetal surveillance that I was talking to you about, accels, decels, early decelerations, late decelerations, what that means in relationship to what's happening with the baby. So I won't be expecting you to get any more in depth than what I talked to you about in class and what I showed you in class, but make sure you are able to recognize those things. The type of fetal monitoring that's available, why we do it, how it's done, how we pick up the best fetal heart rate, where we're looking to place the monitor. What do we use Pitocin for, or oxytocin? What is an induction? What's the difference between an induction and an augmentation? What are some danger signs that we might need to turn it off? What are some considerations of why we're using it? What is the difference between a reassuring and a non-reassuring heart rate? And I don't know why my webcam keeps going in and out, but I'm going to keep going because you can hear my voice. Remember back going to the little handout, the little picture that I showed you about what a decel is and what it represents when it's head compression, whenever it's something to do with the cord. psychosocial behaviors of the mom, physiological behaviors of the mom, and how we support her and her partner. What about epidural and pain management? Be aware of what those nursing management measures are. Very good ATI video that I gave you on your slides to look at with ATI. There's very good ATI video on labor as well. What are some problems with having an epidural and things that we need to watch for? When is an amniotomy required? What is it anyway? What is that? What are we looking for? What kind of problems can happen? What are our priorities? That is the biggest thing that you guys need to start learning. What do I need to do first? What can I do next? What can wait? So that you can analyze your situation. And assisted vaginal delivery. She's trying to deliver vaginally, and we're needing to use measures to help her deliver. So what are those? That's all in your book. And what equipment that we might need to use. What are the indications of that? Why would we even need to use those things? Some of the labor emergencies, you need to know what those are. A placental previa, a placental abruption, ruptured uterus. What are those? What are things that we need to pay attention to, or priority assessments of the mother, and what needs to be done? What is happening to the fetus during a labor emergency, and how can we manage to make sure we have a healthy mother and a healthy baby? If we see a rate that is concerning to us on the monitor, what are some nursing interventions that we need to do if we have a problem? What can we do to help the mother and the fetus? And if those things don't work, what are our options going to be? You need to know your drugs. You need to know what the generic name is. If knowing the brand name helps you to identify that, that's perfect. We are continuing to put both generic and brand names when it's available. Some drugs now are only called by their generic name. So all the drugs that are in your chapters, you need to know those, know what they're for, and know how we would know if we were getting the appropriate effect of those drugs. You need to know what cervical ripening agents, what they're used for, and how we would know that the cervix was favorable enough for an induction. All of that is in your book, and we talked about it last week. Okay, if she is a candidate for a cesarean, what are those special considerations? If she has had a cesarean and is choosing to have a vaginal birth after cesarean, what would those special considerations be to even determine if she's a candidate for that? Why is our prenatal history so very important to make those types of decisions, and why is prenatal care and consistency with a care provider so important? What could happen if mother has a spontaneous rupture of membranes? Or what could happen if she comes in and we're needing to artificially rupture her membranes? What are some emergency situations that could occur that you would need to know how to manage that as a nurse? So mother is in labor, and we're wanting to support her labor as much as possible so that we have a give her every chance of having a successful labor and a successful delivery. So whenever she's in the second stage, what are some things that we can do for her to help her um, promote pushing so that she's not worn out and the baby is not just getting distressed? What are some of those things that can help? All this is in your textbook if you read it. She's in labor. She's wanting to go naturally. What are some comfort measures we can take? What are some things that help her to be more comfortable while we're trying to help her dilate enough to the point that she can have an epidural if she wants one? And that can be pharmacological or non. So all that is in your book. If you are seeing a flat fetal reaction on the strips, mom is having contractions, and you aren't seeing anything, any kind of reaction from the baby very much, what are some measures we can take to improve that? What about the amniotic fluid whenever there is a rupture? What are some characteristics that we are looking for? And if we don't see those characteristics, what are our concerns? What are the positions that are more favorable, positions of the fetus that are more favorable for successful vaginal delivery? Which ones are more favorable for dystocia and a possible problem? What are the types of clients that we would be more suspect of having a possible um, placental abruption, and why would we suspect them of possibly being more high risk for that? And what are some measures that we would take to prepare us for that problem? Okay, think about a umbilical cord prolapse. Not always one that you can see, but one that you might suspect of being there based on what we see on the monitor. And what are some measures we can take to help alleviate that um, before we make preparations for an emergency delivery? How do we bathe a newborn? What are some things that we need to take in consideration when we're bathing? What are our newborn medications? And you need to know those, generic or trade name, so that if you see them again, whether on an exam or whether you're in clinical, you know what they are, what they're for. And if you had a mother that was asking, why do I need to give my baby this shot, you will know the right answers to deliver. What are our gestational ages that we're concerned about? What happens at um, gestation age 20 weeks? What's happening if she gets to 42 weeks? What are we concerned about? What are we looking for? What are the priority things that we need to know if she is at 42 weeks according to her? What is something that we need to make sure we know before we're moving forward, getting all hyper and excited that we're having trouble and we've got a decompensating fetus? What is something that we want to check? Know about breastfeeding, because I know Miss Bradford talked to you a lot about breastfeeding. Um, what do we need to do after the baby is born to help promote the respiratory and everything that's important right after the baby is born? You need to review your IV drug calculation. Some of you are still having problems. You will have an IV drug calculation problem. If you do not know how to calculate drops per minute, if you do not know how to calculate milliliters per hour, please review that. Those are going to be very important, and we still do drops per minute in case we have a power outage in the hospital, and we know how to calculate that. Okay, that should help direct your reading on what you need to do. I do suggest you read the entire chapter. Look at your questions at the end of the chapter. After you've done your major studying, another good place to look to check your knowledge is your ATI book from Maternal Newborn. That's a good digest of the information. Sometimes ATI, as far as a number will go or a range will go, it doesn't agree with our book. The book is what we go with unless there's some discrepancy that is so terrible that we will tell you for patient safety reasons, this is the number we go by. Okay, if you have any questions, always answer my email. I prefer not to have to deal with a lot of questions over the weekend because that's my time. Um, but if it's something that's really bugging you, go right ahead and I'll answer you as soon as I can. All right, we'll see you later. Bye.